Hi guys, I wanted to do a video response to PixieEleven's video on disclosure in therapy with regards to sexual abuse. I think everybody is really individual, and it's completely up to each person as to how they feel comfortable disclosing it, and if they ever do feel comfortable to disclose it. But I just wanted to kind of explain how I disclosed it to my psychologist, because I think the way I did it really worked well for me, and it might work well for other people. Basically, I'd been seeing her for just over a year, and I think she kind of knew, but we always kind of like skirted around the subject. She never pushed it or anything like that, and I kind of would hint, I think, but not ever actually come out and say it. But then it got to the point where I really knew that to move forward in my therapy I needed to tell her, and I'm a very kind of all or nothing person, and so I decided the best thing for me to do was to arrive at my appointment one morning. We went and sat down, and before she even asked how my week had been or anything like that, I said, there's something I really want to talk to you about, but I want to sit and tell it all to you. I don't want you to interrupt, ask any questions. I just want you to let me talk. And then I said that once I'd finished saying what I had to say, I wanted to get up and leave and the appointment to be over then without her saying anything. Because I think I knew I just needed to kind of get it all out, say what I needed to say, and then go. And I didn't want her like interrupting or asking questions. I just needed to explain it all, and then I needed it to not be mentioned. And so she agreed, and she was really good, and she sat in absolute silence as I just completely just talked through the whole lot, from beginning to end. And then when I told her everything, I stood up and I said that I was going to leave, and that I didn't want it brought up in my next appointment. I would bring it up when I wanted to bring it up, and apart from that I didn't want her to mention it. So she said okay, and I left and I went home, and it wasn't mentioned for weeks, and it was only probably about 2 months afterwards that I actually then brought it up again myself, and it was just so much easier because she knew everything, and so then I was then ready to just discuss the actual feelings about it, and that worked really, really well for me. And even now, 2 years on, she kind of will mention it every now and again, but she tends to leave it for me to bring up, and it's perfect for me because that's how I need it to be. So if anybody feels that's a good way for them to disclose anything, in therapy, it doesn't have to be about sexual abuse. It can be anything that they're struggling to disclose. For me, it worked really, really well. So I hope that gives a few people some ideas, and then also on top of all Pixie's ideas. Okay, take care, and thanks, Pixie. Bye.